it was interesting how. Oh, got it. Okay.
I'm just recording what's going on here because that's what we
Oh,
do.
no worries. Okay, mate. No worries at all. But it was interesting how there's so many like diverse stalls there, and how like a lot of the stuff to do with diet was totally sort of yeah, I mean, it's just not my thing at all, you know. So I was only really interested in going to your talk. I'm really not interested in keto or paleo or anything like that.
Yeah.
Did they have some keto booths there?
Yeah, well, they had a talk about keto, which I didn't really hear about, but you know,
yeah,
been there, done there, got the T-shirt. And yeah, just anyway, it's funny when you look at the, you know, the science and everything. I mean, you know all about this, but it just doesn't make sense anyway. Yeah. But very interesting.
I didn't get a chance to look too much at the other booths, but I went around a little bit and went to this one Chinese medicine lady who was trying to convince me that she was psychic. I didn't get too into it, but she could quote tell me everything about me, but it's all obvious stuff. I don't know. It was just like,
oh really?
Yeah.
Was it done in Chinese so you couldn't understand, or was it?
No, she was.
I'm just kidding.
No, but it was just like physical stuff. I mean, I have some very physical quirks because I have MS, and
okay.
So she was telling me stuff that I already knew, but stuff that's kind of like obvious. I don't know.
Right.
But then she was trying to say she was psychic, which may be. I didn't really test her on her psychic powers, but it was kind of weird.
It was actually interesting. There was one girl that shared in the seminar, and she was in remission from MS, which was really great. And she had a booth there where her husband or a partner was doing muscle testing.
Oh.
And I went there and sort of, you know, and they did all these sort of tests of different. I really didn't understand it that much. And then he basically manipulated my neck like in a chiropractic thing. And there was the biggest crack I've ever heard in my life. And I sort of felt dizzy. And then I felt quite good actually afterwards. So yeah, I had a cigarette and then I went home. No, I'm just kidding. I'm just trying to be funny.
Yeah, I liked it. Yeah.
But yeah, it was good. It was good. It was interesting.
Yeah. Interesting. Yeah. I wish we would have seen that.
Yeah. They live in Santa Barbara apparently, and yeah, they test for all sorts of like mold and Lyme disease and all this kind of stuff.
Yeah.
So yeah, it's interesting.
Yeah. Cool.
I'll have to take my daughter to come and see you.
There you go.
Yeah, there's not very many plant-based pediatricians, so.
Oh, that's fantastic. Seriously, that's amazing. I just got a text from my wife. My daughter went to the swimming pool. She's been taken to the because she can't breathe. Oh God. Sorry, guys, that was an overshare, but I think she's probably trying to get out of swimming.
Hope she's okay.
Yeah, no, I think my wife's sort of handling it. She does that sometimes to get out of swimming. There you go.
Well, in case you have to go soon, why don't you tell everyone kind of your story, how you improved your health with diet?
Oh, are we there? Oh, it's 5 past. Okay. Is everybody there?
Yeah, we've got a good group. There may be a few more who show up, but they'll hear it.
All right, so I'll start. I was diagnosed with diabetes in 2006. And according to the test then, I'd only just got into the diabetic level. And then really proceeded to, I went down, like I said, I went down the keto road, you know, because that was sort of, and that did actually help my blood sugar, but obviously it didn't help my insulin resistance, which is, we all know, is the underlying cause. And so the journey through that was pretty hellish. You know, I had some terrible A1Cs. And I always worked out. I've worked out like a demon, you know, like I've always done a lot of weights and cardio, swimming, surfing, you know, I've always been. But in Australia, you know, we're very meat orientated. We have a lot of barbecues, and it's meat for, like, you know, there's bacon for breakfast, meat for lunch, and meat for dinner. And that's, you know, considered to be fantastic, you know. But anyway, it wasn't really until the last few years that my health really started to be a worry. There was one stage where I developed high blood pressure, high cholesterol, high everything basically, and I thought, what am I doing wrong? I'm exercising, I'm trying to eat right. And I don't know how I came upon it, but I was doing research into diabetes, and then it was the Mastering Diabetes guys that actually came up. And this was about 2.5 years ago. And then I started to get on the whole plant-based thing, you know, through COVID and all that kind of stuff. And then the weight dropped off me. I dropped about over 50 pounds. My blood pressure became really good. My cholesterol went from 270 down to 117. And really I thought, wow, this is incredible. This is just what I needed to do. And really since then, to cut a long story, but also I'll add, and I'm not being funny, but I had erectile dysfunction as well, which is a sign of, you know, really clogged arteries. And I did a stress test and all that kind of stuff, and they didn't show anything, but I knew something was going on there too. So, but now I'm 16 again, and my wife hates me. So, but it's just one of those things that is just a fantastic thing, that you don't have to be a victim of your choices, you know, like you don't have to be a victim of that. I felt so happy and my energy levels, and also when exercising now, there's no feeling of tightness, strain. I recover quicker. I do a lot of like cycling and just a lot of walking, and so it really, that in conjunction with the diet and reducing stress, especially for diabetes, has been the best thing that I've been able to do. And I think there's no way that I'm ever going back to eating the way that I did before, you know. And it was I realized, you know, that it's really the saturated fat that really is, and obviously trans fats, but saturated fat and trans fat that really causes the insulin resistance. And then in conjunction with all the plant foods that have all the phytonutrients and vitamins and minerals and everything, that it's actually protecting you from oxidative stress, you know. So that's really, it made a lot of sense to me. Like I was saying to you, Charlie, like I've read all of Dean Ornish's stuff. I've read all of T. Colin Campbell, Dr. Esselstyn, Neil Barnard, Kim Williams, you know, all of those guys that they've been my mentors, you know, over the last, you know, few years. And it's made this huge difference to me. And thank goodness, because, you know, as I said to you the other day, I don't think I'd be alive. I think I would have had a heart attack or a stroke. So thanks for listening, guys. That's really my story.
Incredible story.
Yeah.
That was great.
Yeah,
Yeah,
thank you.
glad-
Yeah.
It's so important for others to be able to hear that. And thank you again for taking the time and coming and sharing that with us. It
Yeah.
really helps a lot of people.
And I really appreciate that. And I feel like I'm, like I feel like I'm always got a religious fervor about it. And I don't want to come across like that, but it kind of is like that. Do you know what I mean? Like it's I feel that this is so great for people, but it's just being able to change their views on. I can't even change my wife or my daughter's view on it. Like they go, "Daddy's a vegan," or So I mean, that's why it's really difficult. I'm sorry. I think I'm getting an emergency call. Can I just?
Yeah.
I'll be back in 1 sec. I'll be back.
All
in 1
right.
sec.
Thank you so much again.
All right. I'll be back in 1 sec. Thank you,
Okay.
guys.
So that sounds a lot like our class.
Yeah, right.
With the I don't know, the passion, and he's one who is going to be able to help convince other people perhaps to
Yeah.
jump on board.
Exactly. It's amazing. Plus, he's a comedian.
Yeah. Yeah, he's fun to listen to. So that's a hard act to follow, guys, but we're not all here just for an act. We're here kind of to share our questions and our concerns and have some fun tonight while we're at it. So anybody in the gallery have anything they'd like to share with us or speak up about?
Well, I'd like to just talk a little bit about my mic's on, isn't it?
Yes.
I just want to kind of comment on what Daniel said, that he's got religious fervor. We all do. I've had to learn to really. People ask you, well, what do you do for protein? And then I got to just be real careful to find out where they're coming from. If they're going to get mad at me because I don't eat meat, I just change the subject because I can tell pretty fast. But a lot of people are worried about their health and they're worried about what they should eat. And those are the ones where I used to think I was preaching all the time. But since I've started being really careful at who I talk to, it's more fun and you're getting somewhere. But people have to want to change. They have to be worried about their health like Daniel was. Otherwise, it's a waste of time. And I swear I've made a lot of people mad.
Probably not as many as I've been mad, Ken.
Yeah, there's something wrong with you if you don't eat animals.
Yeah.
And I'm going to say, and I have a cholesterol-free diet. Isn't that funny? Because a lot of people don't realize plants don't have cholesterol.
Yeah.
Well, it's been fun this last year. I've been doing this. Thank you.
Well,
Thank
thank
you,
you for
Ken.
sharing that.
That's a good way to put it, the cholesterol-free diet. I like that. But I feel the same way about feeling too preachy. You have to be really careful. It's a sensitive issue. I don't know. It's kind of like, politics, religion. You don't want to sort of step on people's culinary feet.
Yeah. Food is just as personal as religion and politics. I mean, it really is. That's one of the challenges of nutrition. It's a science, and we're trying to share the science, but it also overlaps with people's feelings and culture and religion and memories and values. It just ties into all of it. So it's a really tricky subject to try to communicate, because we're just trying to provide the science as a really elaborate, developed science, but where we have to deal with all those human feelings at the same time.
That's why the analogy that Gregor uses over and over of food as medicine versus the smoking is simplifies that. Smoking is kind of an easier issue, helping people understand that you know, it's not healthy for you, and yet it is infringing on their right to do whatever they want by telling them they can't smoke in a public place. But, you know, the food issue maybe carry a little bit more baggage with it in trying to get people to change, but it's a similar kind of issue.
I don't know if Ken can hear me, but how did you come up with the cholesterol-free diet? How did you come up with that, Ken? Wait, you're muted, man.
I wondered if anything else had cholesterol besides, you know, did beans have some? And I just found out no, only animals that products.
Right.
So I just decided, you know, instead of saying I'm plant-based, it depends on who it is. If I think they're concerned about their health and are interested in making sure they're eating right, then I'll go into the plant-based food as medicine thing. But otherwise, I just don't piss them off as much when I.
Yeah,
can't
I
believe
hear you.
so people want to eat meat for a lot of reasons. One is they always have, and they like it, and they don't want to quit. And I know alcoholics like that. And then there's rawhide. You know, Clint Eastwood got famous with rawhide. What did he say about those doggies? Move them doggies on. And you know, we were raised, especially baby boomers, really kind of respecting the livestock industry and thinking it's a great way of life and we want to support it. I did. Well, I actually was in it for 25 years, but there's a lot of reasons people are dedicated to meat. And then there's always this thing that they know they shouldn't be eating very much of it. And they get mad if you call their attention to it. It's kind of like saying, you know, those cancer sticks are going to kill you. So you just have to be careful. But I got to go back to saying one more time, this has been a fun journey, and I've probably made some friends talking about nutrition. And just what I've learned about nutrition in this class is just blowing me away. And I tell everybody that I can, that I think wants to know.
I'm sure that Scott would agree with me that it's been an amazing transition for you personally. We've, you know, seen you come to class after class and ask questions, and it takes a while sometimes to kind of get it and to believe it. And you just talk with so much more confidence now compared to when you first started taking. So kudos to you for hanging in there all this time.
Well, I've certainly got to say that I couldn't do it without this class. There's no question. People need a support team or a support group, and I don't miss these classes. When I'm not here like now, I watch them recorded. So I don't miss a class, and I have to have it every week in order to not, you know, I drive. Gosh, it smells so good driving on Gateway by the Gateway Mall, and I just want to like go have a Carl's makes great hamburgers. Now I haven't had one in almost 2 years, but if it wasn't for this class, I'd probably get weak. But I don't.
Oh, that's great.
You guys been driving? I don't know what it is. It's a Roadhouse or that Wings place.
Yeah.
Something really smells good.
It was like that for me for the first 1 to 2 years, but now it's going to be 10 years in December, and now I can't even walk through like the meat section at the grocery store. It just smells like rotting flesh. It just smells horrible. And then when I smell cooked meat, it just turns my stomach. But it wasn't like that the first year or two. The first year or two, it still smelled good, but it just doesn't anymore.
Daniel mentioned diabetes. I've been pretty I've been pretty dedicated to reverse. I reversed from type 2 diabetes to, well, Scott knows, I'm pre-diabetic now. But I did a lot of research in cutting down on sugar, and then for the first year, when I went into a grocery store that had a bakery, I smelled sugar, and it smelled so good. But I got over it.
Great.
Sugars kill me, and thanks for your part in helping me become a pre-diabetic. And I'm working really hard to stay there, because I won't if I don't keep my eye on the ball.
You'll reverse it. You'll be normal soon.
Yeah,
Well, every morning now I'm 104, so I'm getting close.
Yeah,
Yeah.
that's good.
wonderful. All right, thanks for sharing that. Anybody else have any input that they'd like to kind of share with the group?
I went today to the doctor and
Uh-huh.
appointment, and I told him I'm losing a lot of weight and I can't fit my clothes anymore. I was 109 pounds, and he said, "We're gonna reduce your thyroid medication." So maybe the diet had something to do with it. I didn't tell him that, but I think that because of the diet being more healthy now, that my thyroid is acting more natural too, you know? So that's my thought about it. I thought, well, we'll see what happens. He allowed a blood test and so on. So, yeah. Anyway, I thought this is interesting. That might fit the picture. We'll see.
Nice to hear you're able to thin your medicine a bit.
Hmm.
Anybody else?
I have a couple of friends I want to just mention because they are in, I'll call it blood sugar hell at the moment. They have no history of pre-diabetic problems, but just recently their blood sugar levels have started jumping all over, and all three of them have had prednisone prescribed for various ailments, and they've also had COVID. And I've read that long COVID, we don't know that much about yet, but it's suspected that it's causing some people to appear to be virtually the same as diabetics. And so does the side effects of prednisone. That's a potent drug, and once you get started on it, they have to wean them off of it very slowly. So the only reason I bring this up is that it's muddying the waters. So it's not plain old diabetes anymore. And I really hesitate to try and advise anybody to try what we're doing here. They basically don't want to hear it. They want to follow their doctor's advice only on sticking with that prednisone and other diabetic medications, metformin and so on.
Yeah, prednisone will raise your blood sugar. And then my thought is what probably is going on is they have, in all three cases, they have underlying insulin resistance. And then the stress of COVID on the body, the inflammation, the effect of the prednisone, those all will just amplify the effects of insulin resistance. So if you put the body under that much stress, the insulin resistance shows up because for decades, people have insulin resistance before their blood sugar ever goes up at all. And so you'll have a normal A1C, normal blood sugars, everything is normal, but then you still have insulin resistance developing over years and years. And then some sort of stress on the body, an infection, COVID, prednisone, things like that cause inflammation and cause stress in the body. I'm not all sure all the mechanisms on why steroids raise blood sugar so much. I think it has to do with cortisol, but anyway, then all of a sudden the blood sugars will start to really rise, and you know, if they were to get off the prednisone, get over the COVID or the other infection, probably the sugars would go back to normal. But likely at some point we'll develop type 2 diabetes because the pancreas will kind of poop out, and then the blood sugars won't be able to, the pancreas and the insulin won't be able to keep up anymore. And then basically the effects of the insulin resistance have now kind of been exhausted, and now the blood sugars go really high. And that's what usually what happens is when type 2 diabetes is diagnosed, that suddenly your insulin, your producing cells, your pancreas kind of poops out, and then the sugars go really high. So it's great. This way of eating is great for preventing diabetes. So that's what we recommend.
I have an unrelated question if nobody else is going to jump in here. It has to do with B12 supplementation. I had one source claiming that hydroxycobalamin is superior to cyanocobalamin. He gets a shot every 3 or 4 months. Did anybody know if that's true? Has anybody here tried that?
Do you mean methylcobalamin? I've never heard of hydroxycobalamin.
Hydroxo.
I haven't heard of that. Have you heard of that one, Charlie?
I think there is another form of cobalamin, but we go by the man who has the science, Dr. Greger, and he says the studies that have actually reversed vitamin B12 deficiency have used cyanocobalamin. And so he recommends sticking with the cyanocobalamin as opposed to methylcobalamin. If there's another vitamin B12 preparation, maybe some people could use it. I don't know, but it's not something that the one who reviews every article in nutrition that's in English from around the world and has been doing it for the last 10, 12 years. I trust his judgment, and that's the advice that I'm following. You may have some study from someone who is selling the supplement, and their study shows that if there is a hydroxycobalamin.
Yeah, I'm just now looking it up in Hippocrates, and it's for injection only. So its actual indication is for cyanide poisoning. So it's injection only hydroxycobalamin. Its indication is 5 grams IV for cyanide poisoning.
Yeah, so we used to use an injectable vitamin B12 preparation because that's what doctors did until we got the oral forms. And it sounds like whoever's promoting this likes to have people coming back and giving them shots. So
yeah, it doesn't even say it has a use for B12 deficiency. It's all for just cyanide poisoning only. It's the only thing it says in Hippocrates.
So there's our best response. Is that you got it?
Yeah.
It is confusing. You learn something and then you read another article and it sounds good, and yet it's good to check it out.
How many, I'm sorry to ask, because you said this a lot of times, the bottle of the D12 I'm using says it's got like 5,000% vitamin D I need, and
Yeah.
I only take 500 milligrams. I think I've heard you. Which one is it that you say we should take 1,000 milligrams of?
So it's vitamin B12 is 1,000 milligrams a day if you're over the age of 65, micrograms a day. Micrograms a day, 1,000 mcg. Yeah, micrograms, mcg. That's vitamin B12 for those who are over age 65. Under age 65, you can use 2,000 micrograms once a week, once weekly. So the tablets come in like 500 micrograms. So I take 2 of those sublingual a day of the cyanocobalamin. Does that answer the question?
Well, 1,000 a day for people over 65.
Correct.
Well, while we're on the subject, the calcium. So because I'm in a situation where my urologist is and his staff are concerned that I'm going to have more because I take hormone that affects. I'm getting muscle. Well, I fight the muscle loss and I'm winning on my legs. And then they're also concerned about might have more bone fracture capability or potential and just bone weakening. Now, I'm not experiencing anything like that, but they want me to take an amazing amount of calcium supplement. And what I think I've talked them into is you want me to take 1,200 milligrams, which is twice or more than the bottle recommends. So what I'm doing, I got a deal made with them. Okay, I'll take 600, half what you want me to, and I'll eat a heck of a lot of collards. I would like to, I eat collards for breakfast 4 times a week.
Okay.
And I haven't been able to look yet, but can one of you guys tell me how many how micrograms excuse me, I'm old enough now, my brain like skips a beat.
How many milligrams of calcium?
Does a cup of cooked collards?
It's about 225 plus or minus a bit.
You're not doing bad by telling them I'm going to take half
No.
the supplement you want. You think I should just take 5 cups and quit taking the supplement?
You may want to listen to what Scott had to say when he was talking about this at one point, about how the body does a good job of balancing calcium, and your body takes in more if you need more, and your body, gets rid of it if you're taking too much. It has a good way of controlling it. That calcium is not the primary determining factor of whether you develop bone breakage in your life. Much more important to consider things like how much weight-bearing exercise that you're doing, maybe resistance exercises. So exercise is a very significant component, but diet, eating a plant-based diet is going to be probably the best strategy that you could possibly accomplish. And if you listen to Gregor's videos on calcium supplementation, the more calcium supplementation you take, the higher risk of heart attack and stroke. So, that's hard for your doctors to understand if they've not kind of looked at the literature connected with this. They listen to, the current medical stream. Scott, do you have anything to add to this?
No, just you highlighted the important things. Your kidneys regulate calcium, blood calcium so tightly, because if you're too low or too high, you'll die from a heart arrhythmia. So your kidneys will only allow for a really small window of blood calcium. So you'll absorb it when you need it, like you said, you'll excrete it when you don't. And the more you excrete, the more you'll have chances for kidney stones and things like that, because you don't want calcium in your urine and your kidneys, but it's more deadly to have too much calcium in your blood, so you'll excrete it. So as long as you're getting that weight-bearing exercise, you're getting your vitamin D, you're going to be getting plenty of calcium from the whole plant foods you're eating. And so you don't really need the diet, the calcium supplement, because as Charlie said, it can cause increased inflammation. It can cause a hypercoagulable state in the blood. So it can make you, which is why you there is a slight increased risk of heart attack and stroke when you take calcium supplements,
Supplements, but not
but not from
colors.
food. Yeah, exactly.
Well, I've heard Charlie talk about how too much calcium, I didn't know he was just talking about supplements, can lead to heart disease. It thickens your blood. And
Yeah,
I looked it up. That's where I said it thickens your blood. I looked it up and that's what I learned. And then there's this funny thing that's this conundrum. So I've recently been instructed to take a baby aspirin a day to thin my blood, to reduce the potential of stroke. And so I'm wondering, am I taking aspirin to thin my blood and then calcium supplements to thicken my blood? I mean, why don't you just not take either one?
well, that's a good thought. And it's something that you need to discuss with your primary care provider to make a
Well,
decision on that.
That won't, I know what they're gonna say. Oh, I don't have,
Have you
Hey.
had a heart attack before or a stroke?
well, I might have had I went EIA in June, but I
So
think
if
I
you-
ride enough, I know I ride enough roller coasters to jar my brain around, and I
Okay, so
super
if you
good about that.
if you had a TIA in June, an argument could be made for taking aspirin on a regular basis if they really, had that, and that was the most likely diagnosis of what happened. If the TIA was due to the calcium, then yeah, maybe that wouldn't have been, if it would cause your blood to thicken up and then you had some like clotting and decreased blood flow. But it's hard to really sort that out. I would have difficulty really knowing what would be the underlying cause for that. So the question you have takes a long answer, which I can't really tell you for sure what to do on that topic. I will say that for those who have not had heart attacks or strokes, that the current recommendation is not that the risk of bleeding from aspirin is higher than the benefit. And most people are not advised these days to take aspirin on a regular basis. But if you're, having TIA symptoms regularly, then, maybe that would be reasonable. But again, talk that over with your doctor, see what they say.
Look here, Charles. Baby
But,
aspirin supposed to take.
Yeah, so if you've had a stroke or heart attack, then taking it is reasonable.
Yeah, but today he also said I may have to increase my calcium. And I said I had the shoulder problem, the inflammation. He said that's a different thing. That's not from the calcium. I said there was calcium in there,
Yeah, so you can get calcium deposits in your shoulder, but it doesn't necessarily, that's kind of a reaction to the inflammation, the underlying inflammation that's been going on, not necessarily caused by the calcium. So you first have the inflammation, and then your body kind of laid down some extra calcium in there. So,
but if he doesn't get any calcium, he can't lay nothing down, right?
yeah, you can, because like we've been talking about, your body regulates calcium very tightly. So it brings in more, even if you took no calcium, and it would just try to hold on to it. But if you get below 400 milligrams of calcium a day, that's too low. I think most everybody will agree to that. A reasonable amount of calcium, I can't remember, Scott, is it 600 in Great Britain?
Yeah, most countries in the world is 400 to 600 milligrams a day is what's recommended. It's just the United States is 1,200, twice that, because we have a dairy industry that influences the dietary guidelines. But the rest of the world, 400 to 600 milligrams, and you easily get that with eating whole plant foods.
And
Easily.
eating the greens and the beans, you get easily 400 milligrams a day with what you're choosing to do here.
I can't eat beans. I'm allergic to them.
But you're eating greens.
Yes, yes.
Okay.
I ate
and-
kale this morning in my
It-
soup.
If you're eating kale and collard greens in particular have 225 milligrams of calcium, we eat a cup of collard greens every day. So consider doing that.
It.
You don't
I
like
have-
it?
I
Add a
have
little, steam it, add a little balsamic vinegar to it. Maybe you'll change your taste buds.
Do
I
what?
have a question. Is B12 oral versus sublingual? Is there a difference?
Scott, you want to
Yeah,
address
yeah.
that?
So sure. I mean, so if you, we would recommend sublingual if you have a choice, just because then you're covered. The only people that would have an issue of doing swallowing it into their stomach would be if you have acid reflux and you're taking a acid blocker. So if you're taking Prilosec or Pepcid or one of those because you have heartburn every day, and then you could have some absorption issues of absorbing the B12 if you are. But if you're following a whole food plant-based diet, chances are you don't have any heartburn and you don't have to take a acid blocker. So, but I just, I get it online. I just choose to get the one that's sublingual. I don't take acid pills either, but it's just easy just to throw it under your tongue once a week for me, and I'm done. It's done. So, but that answers your question about that. That's the only, or if you've had like, gastric bypass surgery, some sort of weight loss surgery, that could be an absorption issue as well. And so the sublingual would be better. So if you're taking acid blockers for heartburn, or you've had gastric bypass surgery, go with the sublingual. Otherwise, you could do either one. But if you're on the fence, just go with the sublingual, because then you're for sure covered.
Thank you.
You're welcome.
I missed something. We've talked about injecting it, sublingual and oral. So what's sublingual, please? You said
Under your tongue.
tongue?
Sublingual means under your tongue.
And you don't need to do it every day.
Well, if you're over 65, you do. Say
Yeah.
there's no change there. Just the amount and all that is the same whether you do whichever route you do. But you don't need to do injectable because it's just unnecessary. You just do either sublingual under your tongue or just swallow a pill.
So if we're over 65, should we do it every day? The sublingual?
Correct. Say it's the same. So
Mhm.
whether it's sublingual or you're swallowing it, it's every day, 1,000 micrograms if you're over 65, 2,000 micrograms once a week if you're under 65. So nothing changes with the route.
Wow.
You're overthinking it, Ken. Don't overthink
That's just me.
it. Yeah.
I overdo everything.
Baby aspirin now. You convinced me.
I'm gonna put in my 2 cents on the baby aspirin. I had a heart attack 18 and a half years ago. They had me on a baby aspirin a day for years, but my numbers are all good. The cardiologist doesn't care that I quit doing that quite a while back.
It's good. Yeah.
Charlie, a couple of weeks ago, it came up about Addison's disease. I've been on 7.5 milligrams of prednisone for close to 50 years. And my endocrinologist said that because it's replacement therapy, that I shouldn't have side effects from the prednisone, cortisone.
Oh, okay. And how much cortisone were you taking? Or-
I take 5 milligrams in the morning of prednisone and 0.1 of fludrocortisone. In the afternoon, I take 2.5 milligrams of prednisone.
Okay. Thanks for that information.
And I just saw him a week or two ago, and I've had some issues, and he's switching me over to hydrocortisone and see how I do, see if there's any improvement on some of my complaints.
Okay,
And a friend of mine, he's a drug salesman, and he worked with Upjohn. They brought out prednisone, I think, Delta Zone. And I know probably 15, 20 years ago, he suggested I try hydrocortisone, but because my personal care physician was a associate professor of endocrinology at USC, and that's what he originally put me on prednisone, that I stuck with it, prednisone. Although I don't know if hydrocortisone was available back then or not.
well, you'll see if it makes a difference now with you, yeah?
Yeah.
All right. I'm curious. I don't know if it will or it won't. I haven't seen enough studies to be able to comment on that. Any other thoughts from anyone? This has been fun so far.
It's an open forum. That's exactly what we're doing.
Charlie, I'm still learning.
Trouty, you've come a long way also since the first meeting, and
I know.
I think you were a little skeptical at first, and it's like, come on, I don't really believe this, and
I
it was
don't
kind of,
anybody, but I believe you by now because it's proven right.
yeah. So it has been really a joy watching your transition also. So
I test everything. I don't believe right away.
that's okay. We respect that, and that's good.
Good. Yeah, I listen now, and yeah, I noticed already it helped quite a bit with the B12. You
Yeah.
said 2 of them. I did take 2 of them. The baby aspirin, I take 2 now. I take 1, but
Okay.
my doctor said take 1. I didn't believe him. I did for a while, and then I said, okay, I don't have no problem anymore. I'm not going to take it anymore. But you said take it. So yeah. Anyway.
Okay. All right.
My
So-
father was a federal meat, he was a federal meat inspector for 37 years. I don't know if he's still alive. What do you think about me going off meat?
What? He was a meat inspector, huh?
37 years.
Wow. Wow. Interesting.
When he's 39, he got brucellosis.
Uh-huh.
He said that prior to that, he felt like a teenager, and after that, not again.
Interesting.
It's occupational risk.
Yeah. Okay, Edward. You've been patiently waiting.
I've been coming to these classes since about like January, just kind of sitting here, not really saying much. But I've been struggling a bit with the transition, especially at first. But I don't know, I tell them. But just recently, in like the last week, I started making chili in the crock pot, just with a ton of beans. Chop something up different each time. And so I ate that for a couple weeks. And then I made a salami sandwich just because I wanted to get it out of the fridge.
Yeah.
And my stomach just punished me immediately.
I don't mean to laugh at you. I'm not laughing at you. I've heard the story before about.
Yeah, otherwise I felt great that week, but just immediately it's like,
Yeah.
no, don't go back to that.
Well, there was
Thanks for sharing
probably a time in your life, months before these classes and over the years, where you wouldn't have even recognized, even thought about that being a possibility, that eating some food would cause you to have that kind of reaction. I don't know, particularly foods you like.
Yeah, I got so used to feeling crappy.
Yeah.
It's just how I feel all the time. But wow, it really doesn't have to be.
I like your use of, you get used to feeling crappy. It's because you were eating calorie rich and
Mhm.
processed food, crap, calorie rich and processed food. And that led to you feeling that way. Okay, just a thought.
Charles, I got another question,
Okay, Truddy.
I found another chocolate in my freezer and I thought I want to get rid of it. No more chocolate. Well, I ate the chocolate and guess what? I got a horrendous stomach ache. I used to eat that all the time. It's no problem. This time, the last of the chocolate, I'm breaking that too. So, but I think it was the milk. It was milk chocolate and I'm
Yeah.
allergic to the milk, but it made such a difference that I had the whole food plan diet before. And now all of a sudden I can't handle the milk chocolate anymore, you know? So horrendous stomach ache with it.
Okay, so I have a theory about that. I just thought of it while I'm listening to you. I'm thinking you go along and you're eating a diet and you're not feeling so good. You get used to it and you feel like normal, but feeling normal is not feeling so good. So you're eating these foods. Then you change and you start eating a diet where you actually feel good. When you eat the food that was making you feel so bad, now it makes you feel bad and you didn't realize that before. It didn't make you feel as bad before because you were feeling so bad before. Now that you're feeling better, you notice the difference. Just a thought.
Maybe so. I don't know. I'm not gonna eat no chocolate no more. I have to buy it and I won't buy it no more. But I thought I
Okay.
get rid of it. I don't want to get tempted. So
Ah.
yeah.
Yeah, for me, it was like I didn't realize I felt bad until I felt good. Like, so when I was eating the old way, I felt, oh, this is just normal and I'm fine. Yeah, I have some irritable bowel symptoms. I have to rush to the bathroom sometimes, but this is normal. Or heartburn every evening. I guess that's just normal. But then when I actually felt good, I was like, oh, this is what it feels like to feel good. Oh, I don't have to rush to the bathroom or have heartburn anymore. Oh, okay, this feels great.
I think it's more sensitive now to all that crap that before, you know. So yeah.
Yeah.
Have you ever heard the philosophy that part of the human condition is it's both our great strength and weakness to be adaptable to things? In other words, you can get used to anything. You could hitting yourself in the head with a hammer.
Yeah.
You can get used to.
Well, that's
Yeah.
the analogy Gregor uses, that we're hitting ourselves with a hammer 3 times a day with the foods that we're choosing, except those of us in this room. All right. Anything else from anybody?
Well, another effect that this has had.
Tell
Is-
us, Ed.
The biggest thing that sabotaged my diets in the past is coffee. Because that was the one thing that was off limits. I'll cut calories everywhere else, but I gotta have my coffee and I like it sweet.
Uh-huh.
But lately, I've been putting less sugar in my coffee just out of preference, and now I'm down to 1 cup, like voluntarily. Like I'm not craving a second cup, and that, I don't know, it's bizarre.
So one of the thoughts could be cravings come when you're not getting an adequate amount of nutrients and nourishment, and your body is kind of telling you, I need more, I want more, I want more. When you start getting enough of the things that your body needs, perhaps it just decreases your desire to need more of whatever it is, the sugar or the chocolate or who knows what. So that's an interesting take, that you're recognizing that you were able to cut down bit by bit.
I actually thought it was an emotional dependency kind of thing, because anything can be addicting.
Yes.
But I don't know. It just takes one cup a day now. That's all I need.
Nice. Nice.
I lost quite a bit of weight pretty fast a year ago. And I use coffee, black coffee, and I give it some credit. And I say I used it to help me lose weight. So it kept me from eating and, filled me up, and satisfied me. Now, I drank a lot of coffee, like 6 cups a day, but now I'm down to a couple and I'm drinking a lot of tea. But I give coffee credit for helping me eat less. Probably gave me some energy too, but that's generally not a problem for me. Just wanted to say coffee can go both ways, and I'm sure drinking too much is bad for you. So I managed to wean down and drink tea instead. Tea's fine.
Yeah, the drinking too much coffee can lead to increased caffeine. Of course, you're getting more caffeine, and that can cause tremor and anxiety and, other kinds of things that so many people are troubled with.
Somebody
Okay.
better raise their hand or I'm going to keep asking questions.
Anybody else have a question before Ken has his next one? I'm looking around the room here to see if we see anybody.
Also, some feedback. Feel free to people that attended the classes on the lifestyle medicine pioneers, the fasting, and the pandemics. If you had any questions or comments about those last 3 classes, it'd be appreciated too. And also be thinking about what you guys want to cover the latter part of November and December. We kind of, what we did last year about that time was just kind of took advice from the class attendees. What do you guys want to talk about next week? And then we just kind of, or we'd even sometimes wouldn't have a plan, but we would just, the conversation would go, and then I would label the class, whatever was the kind of the predominant theme of the class. Because next 3 weeks after tonight, we're going to have the kind of the review, the question and answer session, the 34 questions that Charlie has, the things we hoped you learned from this past year. And it's also great for the new people that are coming to kind of get an idea of what facts we hope you learned or we find very important in these classes. That'll be the next 3 weeks, and that'll get us to the middle of November. And then we, like last year, we talked a lot about cooking for the holidays and family issues, social issues. We kind of had a potpourri of different topics to get us through the end of December. And then of course in January, we'll start the whole thing over again. So just kind of be thinking about topics you guys want to cover after the next 3 weeks also.
What was
it, Ken?
Go ahead, Doug.
How much fat should you have a day for a appropriate absorption of the fat soluble vitamins?
Well, there's not really a milligrams of fat you need, but in general, if you're eating a 100% whole food plant-based diet, you're getting about 10 to 15% of your calories from fat, which is plenty. But if you're, as far as the fats you need just to exist, to be healthy, but if you're adding some nuts and seeds and some avocados and things, you're probably getting 20 to 25% of your calories from fat, and that's more than enough. But in general, we try to stay less than 20% because especially if you're trying to lose weight, you'll have a harder time losing weight if you're above 20%. The typical standard American diet is 30 to 50% fat, just in general, the standard American diet is. But yeah, even broccoli is like 8% fat, so it's like every food has fat in it. So someone that's on the thinner side, maybe like yourself, you probably could afford to have some nuts and seeds and avocados and get maybe 20-25% of your calories from fat.
I have atherosclerosis, so I'm trying to gain weight and also trying to greatly reduce my fat intake. It's problematic.
Yeah,
but, although the fat from nuts and seeds and avocados are not going to be clogging up the arteries, though. So.
And make sure, if you have the atherosclerosis, that you listen to Esselstyn and have greens several times throughout the day.
Yeah.
Dark green leafies.
Thank you.
Anybody else?
Hi, Dr. Ross.
Oh, I'm so glad that you chimed in. I was just thinking about calling on you and because I wanted to hear from you tonight. You're looking comfortable. You look professional there in your scrubs. Lisa, it's good to see you.
It's good to see you all. That's actually what I wanted to say is I'm on my internal medicine rotation right now. So I'm working in the hospital 7 a.m. to 7 p.m. and then 7 p.m. to 7 a.m. next week. But it's really nice to see all of you here because in the hospital, I see a lot of really, really sick people. Usually, almost all of them, some diet factor has played a role in their gallstone surgery that they've just had, or their diverticulitis, or heart failure, stroke. And all of these people are just so severely sick. So it's really nice to see some healthy, happy faces. And surprising, or not so surprisingly, but I've been able to give a few little diet nutrition talks in the hospital. Sometimes it takes a really significant event to kind of scare people into it, but I'm just glad that they're receptive to it and that I have the knowledge to share with them. And as a med student, a little bit more time than the attendings do. So I usually just ask if I can sneak back into their room and give a little talk. And all the doctors are really grateful for it. So I'm really glad that I've been able to learn from all of you here too.
So I'm curious if you've found any doctors who are like totally supportive, who are plant-based themselves and are just like, oh, great, we're glad you're here. They're allowing you to go in, it sounds like, to kind of talk to people about healthy changes, but do they themselves, have they jumped on the bandwagon, or are they somewhat resistant from your thought process?
Nobody has really been resistant. I'd say most commonly the doctors have been really grateful. I've had lunch with most of them at least once, and I can tell that they're not plant-based, but they are still like grateful that I am and that I will want to go and talk to the patients about it, because they just admit that they haven't had the training in their careers or medical school. So it's hard for them too, because they're just so busy with so many things.
Well, keep planting the seeds and keep doing what you're doing. And, if they see it from another student or two that comes along, they may change their mind one day. Hopefully. Just like Sanjay Gupta changed mine. It took me till the age of 63. Most of the doctors you're working with are probably a bit younger than that.
A little bit.
Anyway, thank you for chiming in. Do you have anything else you want to contribute?
Just really quick, I have this patient that's like really touched me for some reason. He's 83. He came in, he has type 2 diabetes with pretty significant peripheral neuropathy. And so he's got ulcers on his feet. And he actually had an infection of his toe, his big toe, actually developed into osteomyelitis. So a pretty severe infection. And then he had to get that toe amputated. With that, we found that he had pancytopenia, meaning all of his blood cells, like white blood cells, red blood cells, platelets, everything was really low. and he had a history of lymphoma. So we were worried it was a recurrent lymphoma. The biopsy came back today and it was negative. So he could have this like drug-induced lupus situation with this other medication he's on. Anyway, he has a lot going on. He's very sick. He probably has more going on than all my other patients, but he is also the happiest patient that I have somehow. Every day I go in and he says, "I'm feeling fantastic." And he's like on all these machines and like can't really move. But I think the mind is very powerful, and I think he is going to be okay and he's going to heal well, because he just has a really great outlook and a really positive attitude. And that's a lot of the recovery process as I'm learning.
Wow, that's great. Thanks for sharing that.
Great story. We love it. Thank you, Lisa.
Thank you.
Anybody else?
Mhm.
Hey, Daryl. I'm good. I'm right in the.
I think we forgot to ask if anyone else was new besides
about
Daniel earlier.
3 minutes.
I thought I saw a name I didn't recognize. Is there anyone else that's here for the first time? Maybe not.
So let's see what the gallery looks like here. We got a gallery of a number of people. I don't see any particular other hands up. But we've done pretty well. Now we're in almost 10 minutes. We're whoever didn't hear the very first 10 minutes of the class, you probably want to go back and listen to the recording. It's a pretty good testimonial from a brand new member who we met this weekend at the health fair. So we'd encourage you to do that. Ken, I'll get to you in 1 second. I do want to let those of you know who are in the room. I don't know, is anybody interested in seeing Dr. John McDougall tomorrow in the Zoom room like this? Because he's going to be meeting with us at in nutrition and medicine. There's 3 medical schools involved, but he's in a Zoom room. So if you're interested, I'll put the link in the room.
Please do. I'd appreciate it.
Okay. So I'll
So I had I had the Zoom number that you had sent me, but there was no link. It was just the Zoom number, and I put that in the class email.
Oh,
on
did you?
Sunday.
With the password?
Yeah, because there was no
Okay,
link like last time.
Because I didn't get the link this time either.
Yeah, it's just the actual number, the Zoom number with the password. And I put that in the class email on Sunday. And what I did forget to put in the class email was that besides John McDougall, I did put that, but he's talking about diabetes, it looks like.
Yeah,
What
he's
time
talking.
is it? I'm sorry.
5 o'clock. At
It's
5
at
o'clock.
5 o'clock.
Okay.
So do you have the email from this week? Because it'll be in there.
Thank you. Yes.
Yeah, it gives you the Zoom number, and then nutrition and medicine is a capital N, a little I, and a big M, capital M, for the password to get in. Someone doesn't get the class email anymore. So
Yeah, check your junk file. That's the thing that happens if you were getting the class emails in the past. Since if you've gotten the class email since March, you're on the email list, but you just have to check your junk file if you aren't getting it.
And
So
I
if
will
you-
put the number in the chat room anyway, but do what Scott says too to check it out.
So that is at 5 o'clock.
It is at 5 o'clock tomorrow.
Yeah, and Doris, who just put in the chat room, you are on the class email. You're getting it every week, but you've never opened any of them. So what that means is it's probably going to your junk file, in your email junk file. So you got to go check that out and check that regularly, because I have a MailChimp account and I can look and see who opens my emails and who doesn't. Just divulging a little secret here. And it shows that you've been getting the emails every week, but you haven't opened any of them. For Doris Germain. I have Doris.Germain, GERMAIN @Comcast.net.
Something that Miss Lisa said just a moment ago reminds me of a brief story I'd like to share. She
Okay.
mentioned a man having a toe amputated because of diabetes. I've been a jazz fan for a long time, since the 1960s. One of my favorite performers ever was Miss Ella Fitzgerald. She was a person of tremendous energy and endurance until her late 70s, when diabetes finally flared up and took a toll. In fact, she had both legs amputated below the knee and never performed again in public after that.
Huh. I can't seem to get this to print. Huh. Whatever. Best laid plans. Chat. Chat. Okay, well, for those of you who don't have the email, I guess I'm gonna have to have you,
Charlie, I just put it in the chat box.
oh, thank you.
Yeah, I went to the email that Scott sends out, and that's the information that was in it.
Perfect. For some reason, I can't put
Yeah.
mine in there. I
Yeah.
don't know why that is, but
Okay, well, I just put it in, so people should be able to see it.
I
if
can
they
see it
open the
now.
chat box. Yeah,
Thank you, Evie. Really appreciate it. Okay,
Sure.
Ken, you get another opportunity.
Okay, just want to talk about lycopene, the red pigment in tomatoes.
Uh-huh.
And I don't know if I ran across it somewhere else. I have an idea, maybe heard it here, or both. So there's an association of lycopene from tomatoes with prostate health.
Yes.
And is that proven? Can I tell people it's proven, or do I just keep saying it's associated?
Well, I think that's the words that Dr. Barnard uses. I've heard him in the past. I don't know much more about it in terms of the overall statistics related to lycopene and prostate. I'm looking it up right now again. It says regular consumption of lycopene-rich foods has been reported to be associated with 30 to 40% lower risk of prostate cancer.
Well, it's too late for me, but I was hoping maybe it'll help keep my cancer cells at bay. The hormones have stopped the activity of the cancer cells, but I figure I love tomatoes, marinara, salsa. I eat a jar of salsa a day.
Wow.
I hope it helps. But between the hormones and, well, hormones, it just stopped. It's been a year. I've been undetectable, and that's super good news. But I'm hoping the tomatoes will add to it. I don't want them splitting, multiplying, because once they decide to metastasize, then that's it. You've got to get all your affairs in order. So I'm avoiding that. And that's the biggest reason I was looking for another lifestyle, another way to eat.
Yeah, so eating lycopene seems like a reasonable thing. I see there is one study showing attempt at slowing it down. Dean Ornish has shown that in early stage prostate cancer, you can kind of lower the PSA value, effectively reversing the disease if you're not eating the insulin-like growth factor 1 foods. With a hormone, you're not going to tend to promote the progression of it. So you're doing what you need to do.
Well, I really feel good. And, you know, this lifestyle is 100% the reason. And I do a lot of resistant exercise on my legs.
Well, then keep doing what you're doing. Try not to let the doctors worry you too much.
You know, they just don't. I told you before, I've got 2 doctors that definitely don't really know anything about it and think I should eat meat. And then I've got 1 doctor that says, I don't know enough about nutrition to advise you. So.
Well, that's
But then
good
I've-
honesty, at least.
And I got some physician's assistants that are either very helpful or very interested in what I have to say.
Great. One's in the room.
Okay. I was trying to be careful, but there's a PA at the urologist that she's the one that really pushes the calcium supplements, but she's super interested in healthy eating. But her husband is a commercial fisherman, so I think they are never going to quit eating fish.
Probably not.
But
It's a tough sell. However, I must tell you this story. It's about a med student who rotated with me one time when I was practicing, I don't know, a couple of years ago, maybe 4 at this point. And he told me he comes from Montana, his dad owns a barbecue, and you know, he's going to keep eating meat. Well, after listening to me talk to my patients, he decided at the end of the rotation that he was going to do for 30 days, take on a totally whole food, plant-based diet. He lost a bunch of weight. He told me he felt so much better. And then about a year or 2 afterward, he contacted me again, said his dad, who owns the barbecue, has gone completely plant-based. And it was very heartwarming to hear that story and have that impact. So, you know, you can be a commercial fisherman, I guess, and still be a plant-based eater. This is all your choice in this world. And there have been people who have really surprised me who I thought would never do this, who have, you know, just changed completely. And there have been other people I thought, oh yeah, they're doing this, they're excited about it, and they just keep coming back week after week and do nothing to change. You know, like you know, would have to stand on my head, get down on my hands and knees and beg, and it still probably wouldn't make a difference. By the way, I did get down on my hands and knees and begged a patient to change what they were doing in front of a PA student. It's her second rotation. And I told her that I was trying to break out of the mold of what she'd seen about how doctors talk with their patients, that sometimes you have to be a little dramatic and passionate. And, you know, I wouldn't do that for everyone, I told her. But she got a kick out of that. And I don't know how the patient took it. I think they laughed a little bit and smiled to themselves. And, you know, she's been fairly impressed with helping people transition to healthier food choices. So I think it's working for her. I don't know how well it worked for the patient.
Charlie, that must have been unforgettable to see that.
Yeah. Well, I probably shouldn't share all these stories with you, but I have too much fun sharing them.
Good. Makes you human, you know.
Well, that's what I try to be. All right. Any other comments? Ken, you have a question. You're not the answer man. You're the question man tonight.
I just forgot to lower my hand.
Oh, okay. Well, we're just scanning through the room and checking it out. Ed, thanks for talking tonight. We appreciate it. We've seen you in the room a lot of times, and it's nice that you got comfortable enough with us. And as Scott says, this is our tribe, and as we get more and more comfortable, we can kind of share with each other without feeling like we're going to be attacked or whatever. Yes, Doug or Abby.
The problem my family has is my wife has a nephew who's a marine biologist, dives a couple times a week. He knows where every lobster source is in Southern California. And when he makes lobster tacos with homemade salsa, with homemade grown tomatoes, yeah, it's beyond our resistance ability. And we also have an observant Jew who married into the family, but he says when it comes to lobster, it's too good not to eat.
My nephew who catches the lobster is also whole food plant-based, and his only, deviance is when he catches lobster.
That's pretty interesting for sure. Wow. All right.
I will say he grills it and he does not put any butter on it. It's just grilled with the tomatoes and the homemade fresh salsa.
Okay. Well, we had a pretty fun class tonight. I don't know that we have to go another 5 minutes, but if anybody has a question, we've got the time slot. And
go ahead and don't forget to send me your updated question and answer list, Charlie, so I'll get it posted on the website prior.
Oh, I need to do that.
Class.
Is next week the first class of that?
Yeah. Next week's the first of the 3. We get three weeks to go over those. So they only have to do about 10 or 15 a class. So that'll be good. Instead of having to try to rush through them, we can take as long as we want to go over them, really, to be honest. But
right, well,
I figured 3 weeks would be good.
I'm going to put that on my list to do, along with the 2 other programs I need to learn from the medical school and the questions I need to write for the musculoskeletal system.
Well, at least your questions for class are already written. You just have to send them.
They are. I just need to organize them and just send them to you. I'll do it, Scott. I promise.
Charlie, you have energy because you're whole food plant-based.
Yeah.
Very good. I love that.
You should have seen him at the health fair. He never sat down once. He was up and moving around and standing and
and that was from what, 9 to
9
6.
to 6, yeah, yeah.
I actually went home, I think at 5:15 or something.
And then
Oh, yeah.
don't forget your vitamin B12.
Okay.
Right.
Yeah, that keeps me going too. Okay, Scott, it's the questions to Scott. Very good.
Yeah. And I'll put those up on the website later this week or this weekend, so that people can access them. Then when we start class, I'll pull up the website and show everyone where they're at, and I'll put them under the handouts from class section is where I plan to put those. And then
Good
you'll have all
plan.
the questions, all the answers, and we'll go through, and yeah, it'll be good.
Sounds good. Okay, everybody. I've really enjoyed the time with you all. I think Scott has. Eric, thanks for the input, and all the rest of you who've contributed. Ken and Dorothea and Trouty and Edward, and Eddie, and Evie, Tolly and Lisa and everybody. You know, it's just nice to have you all in the room, and even the people who you know, so many of you have been to so many classes already. Nice to have you all.
Thank you
All
so
right.
much.
Have a good- See you guys next week.
Thank you.
Thank you.
Take care.
Thanks.